Now, if you go to the key objective for the exam or for this particular topic, you realize that given a patient who is at a risk of fall, the candidate will identify contributing factors. So this is another thing you need to master so far as this particular objective is concerned. Contributing factors to falls and initiate an appropriate management and prevention plan. Now, given a patient who is at a risk of falling, then we go to the enabling objectives. The candidate will list and interpret critical clinical findings, including those which are based on description of recent and previous falls. So if you are taking a history of a patient who has falls, one thing you don't want to forget is to ask the patient, have you had any falls before? When was the last time you had a fall? When you had a fall, what happened? Did you hit your head? Did you break any bones? Okay. And then a medical history of risk factors. So when you are taking a history of somebody with falls, you want to ask about medical conditions the patient has. Do you have any heart related condition? Do you have any chest pain? Do you take any medications which can lead to falls? Do you have any concerns with any substance use disorder? And then you can also talk about environmental hazards. What is the nature of the house you stay in? Do you have stairs there? Do you have carpeted floors? What exactly is going on in your life? Because you want to know all these things. And then a complete and functional evaluation, a complete physical exam and functional evaluation. And then list and interpret relevant investigations and construct an effective initial management plan, including managing. So you want to put in an effective treatment plan for all your patients who have a history of falls. You want to do that and suggest specific interventions for preventing further falls. What can you do if a patient comes to you with falls as a result of medication use? What do you do if a patient comes to you with falls as a result of vertigo? What do you do in all these situations?